Hello and welcome to the Swansea Bay Cardiac Rehabilitation Team's presentation on emotional well-being and your heart. Now before we start, I need to share with you the limitations of this presentation today via this disclaimer. This presentation should be used for general information purposes only. It is not a substitute for specific psychological advice or treatment from a psychologist or other suitably trained health professional, and it should not be used as such. Because each person is unique, please consult a qualified healthcare professional if you have any concerns regarding your psychological health. For individual cardiac rehabilitation advice, please consult your local cardiac rehabilitation team. If you are experiencing any changes in symptoms, please seek advice from either a GP or a specialist. In the event of severe chest pain or breathing difficulties, please dial 999. So, this is me. I'm Claire and I'm the psychologist within the team. Please excuse my lockdown hair. I'm hoping that my hairdresser is going to get to me in the near future. Like many of you, she's been shielding and I'm one very loyal customer. So to tell you a bit about me within the team, I provide support with making lifestyle changes over the long term and also managing the emotional impact of cardiac events. When you've had a heart attack or heart surgery, it can also take some time just to generally come to terms with everything. So it's also part of my job to provide some support and some education around this. So here's the plan of what we're going to look at in this presentation today. We'll look at why emotional well-being is important in cardiac rehabilitation. We'll also consider that there are many emotions that people might experience after a heart attack or heart surgery, and that there's no right or wrong way to feel. Everybody is different, and that's okay. There are some things that you need to look out for emotionally, just to ensure that you're making the best recovery that you can, both physically and psychologically. We'll spend some time looking at those so that you know what to notice and what to do if you think you need some more support to feel better. And finally, we'll look at some things that you can do to keep yourself emotionally well at any time, including when you're recovering from a heart attack or heart surgery. So one of the things that we know about acute cardiac events is that they can have a big emotional impact. Now, you might have found yourself feeling several of these emotions that I've just put up here during and after your admission to hospital, whereas you might not have experienced others. The emotional impact of an acute cardiac event such as a heart attack or heart surgery is very different for different people. Everybody's emotional response is very individual. Now, you might notice down there on the left-hand side, we've got stress there. We know that stress in itself is a risk factor for heart disease. For this reason, we've got a presentation all about stress just by itself in our collection of presentations. If you feel that stress is an issue that you'd like to know more about, I'd encourage you to go and take a look at my colleague Maria's stress presentation on that very topic. So I guess the question is, why do people react so differently? Well, we're biologically wired up to experience emotions because they help us to function and survive. Without them, we would never have survived as a species. Our brains learn from our life experiences, and we experience emotions ultimately to help us navigate the complexities of getting through life successfully. As individuals, we will have all had different life experiences, and so our emotional reactions are shaped by these. For this reason, it's completely understandable why people will respond differently to traumatic events like heart attacks or heart surgery. There is a saying that you can't judge a book by its cover, and that refers to not being able to predict how a person might react to things or what they've been through in their life. Now, I always think that that's a really good way to think about why people have different emotional reactions to similar things. What I'm going to do now is just talk you through the most common emotional reactions we hear from people within a cardiac rehab setting. They may or may not resonate with you too. See what you think. One of the most common reactions we come across is the "I didn't see it coming" reaction. There was little or no warning. The person didn't anticipate that a cardiac event of any sort was on the cards for them. Everything happened really quickly. It was a massive shock. This can sometimes leave people with a sense that life has completely changed in a single moment. They'll never be exactly the same as they were now that this cardiac event has happened to them. And because the person didn't see this coming, they weren't ready for this. This makes it really hard to get their head round it, and it can sometimes take a while for your mind to catch up with your body for that reason. Cardiac events are often a time of great change for people, especially if they want to recover well. Now, some of those changes are likely to be short term. For example, many people struggle with things like feeling more tired and low in energy after their cardiac event, or not being able to do the same things physically, such as things around the house or the garden that they did before. Now, I can't give you an exact time frame for how long it will take to be able to get back to those things, because people have different bodies and different physical factors to take into account. So they recover at different rates. The amount of time varies for different people, but people we've worked with find that when they engage with a program of cardiac rehabilitation, even home-based programs, they normally notice some improvement by the end of their program. Some of the things that change, however, like lifestyle changes to keep your heart and body as healthy as they can be longer term changes. And this can sometimes be harder to take on, especially if we like things as they were before. Another long-term change can be having to take medications. This can be difficult to accept, especially if a person didn't really take many medications prior to their cardiac event. I think it's also really important to realise that in the short term, this can have a massive emotional impact upon people. People speak about feeling stressed, confused, angry, worried, or depressed in response to lifestyle changes being discussed with them. This usually boils down to the fact that they didn't ask for a cardiac event to happen to them. It just happened. It wasn't on their terms, and they had no choice. There is a big difference, for example, in making dietary changes when it's because a person's decided that that's what they want to do. Serious health events can make us feel that we have to make lifestyle changes and take medications, even if really we don't want to. And that can feel very unfair to many people. Another common reaction that we see within cardiac rehab is people being afraid of having another cardiac event. This can lead to what we call hypervigilance. This is a process of being on high alert to look for danger. In our case, it kind of means constantly looking out for signs that our heart is or isn't okay. This is a completely understandable response if a person's had a cardiac event, because our emotions are making us do exactly what we need to do to survive. Look for threats and respond to them effectively. However, there are some downsides to this. People often describe being very aware of physical symptoms, particularly niggles and twinges, especially in the first few weeks, even though they wouldn't normally be bothered by them. This can be worrying, and it isn't helped by many of the physical aspects of being anxious, which can be quite similar to cardiac symptoms. Many people also find that they become fearful of doing anything that they think might put pressure on their heart, despite many of those things actually being quite helpful for their recovery. Some people also report experiencing hypervigilance by proxy. They themselves aren't really very worried at all, but their family members or support network want to wrap them in cotton wool and protect them from having another heart attack. This can be frustrating and is a common source of stress during recovery. We often see people struggle in the early days with having to slow down or abstain from certain tasks and activities in the short term. It can be frustrating, stressful, and infuriating not to have the freedom to do what we want in life. Sometimes even more so if you're trying to recover from a cardiac event and get back to normal. This might be due to physical limitations associated with your recovery. It might be because a health professional has said specific activities need to be avoided. It might be because a workplace has got regulations and occupational health requirements. Or it might be because family or supportive others are concerned about our health and are trying to stop us from doing things that they think might put us in danger. This is also something really common that a lot of patients experience in the early days of their recovery. We also see a lot of people in shock of the cardiac event happening in the first place. It's not unusual for people to respond to shock by having a sense of things not feeling real. Many people report feeling numb or switched off, or withdrawn or disconnected from the things and people around them. Some people can also become quite grumpy and irritable in response to shock too. Now, the reason this happens is because the person has experienced the cardiac event as traumatic. And this is a very, very normal initial response to trauma. Basically, the brain's trying to protect the person from the overwhelming emotional impact of what's happened to them by essentially blunting them to their emotions, which enables them to function and look after themselves. It also helps them to dismiss anything that it's not necessarily to take in or deal with at the moment. At the same time, their mind is trying to come to terms and make sense of what's happened. And sometimes that can create a bit of a mismatch. A person might find that they're trying to avoid anything that triggers an emotional response about what happened, because they're not ready to deal with it yet. This tends to be quite a short-term response, and people find that sometimes they find the emotion of it catches up with them a bit later in their recovery. Once they've got through the upset and worry of it though, they often start to feel a lot better. Now, it isn't always doom and gloom having a cardiac event. Many people also experience something that we call post-traumatic growth. This basically means that the cardiac event has had a positive impact upon somebody's life, and they experience positive emotions in line with that. I fondly remember one gentleman at a cardiac rehab group telling me, "I know this sounds strange, but my heart attack has been one of the best things that's ever happened to me." Now, here's why he said that. Many people feel like they've been given a second chance, like they've got the opportunity to live a healthy life and they've got everything to live for. Some people also experience a sense of clarity and have a better understanding of what's important to them in their lives. They take the opportunity to do some life laundry, getting rid of the things that bring them down and increasing the things that bring them joy. And they use it as a basis for making positive, healthy changes to their lifestyles. They feel thankful that the outcome from their cardiac event wasn't worse. And they report experiencing an increased sense of pleasure in their everyday lives. Now, the chances are that you might have experienced a whole cocktail of emotions. Your mood might be up one moment and then down the next. Sometimes it can feel like you've been on a bit of a roller coaster emotionally. The good news is that there's no right or wrong way to feel in the weeks and months after a cardiac event. Anything that you feel or anything that you don't feel is all completely normal. What you should find in the coming weeks is that as time progresses, you should start to feel more settled emotionally. You and your loved ones will get over the initial shock. As you engage with cardiac rehab, you'll start to feel more well. And you will come to terms with what's happened and adjust to a new normal. That said, there are some things that you can do to help yourself adjust and get back to a new normal following your cardiac event. Firstly, allow yourself space to experience these feelings. Blocking them out doesn't help and often makes things feel worse. Spend some time every day doing something that gives you pleasure, as this will help to boost your mood and give you a sense of purpose. Engage with cardiac rehabilitation to help your recovery, boost your knowledge about managing your condition, and make some healthy changes. And finally, encourage your friends and family to learn about your condition and talk to them about the kind of support you feel you need from them. Like emotions, support is a very individual thing, and different people will want different things to help them feel supported. So I just want to take a moment at this point in the presentation to talk about why we focus on emotional well-being in cardiac rehab. The reason why we incorporate emotional recovery as well as physical recovery into our programs is because the science says so. Few people realise that there's an actual physical impact between depression, anxiety and heart disease outcomes. A recent study by Chadder and colleagues showed that patients with anxiety or depression experienced more atherosclerosis, also known as clogged arteries, were more likely to make unhealthy lifestyle choices, showed higher cortisol levels. Now, cortisol is a hormone which leads you to be more alert and ready to respond. Now, one of the things that this hormone does is it increases both blood sugar levels and also blood pressure as well. They also demonstrated higher levels of other hormones such as adrenaline, which can increase your resting heart rate and lead to a greater increase in heart rate with exertion as well. They also observed greater platelet activity. Now, platelets are the clotting agents in your blood which make your blood thicker and stickier, and this can sometimes lead to an increased risk of a blockage of the blood flow. Also, being anxious or depressed also decrease the immune system function, and that makes people more susceptible to physical illness. The good news is, though, that we know from other studies like this recently published one, that if anxiety and depression is treated and well managed, a person's heart health improves. There are a number of both psychological and medical treatments available for anxiety and depression, and we can therefore improve cardiac rehab outcomes by making sure that people get the appropriate support for their emotions when they're recovering from their cardiac events. So given that some emotional distress is normal following a cardiac event and things do often pass in their own time, How do you know if you might need some help with your emotional recovery? Well, there are some things that we ask our patients to look out for, namely signs of clinical anxiety, clinical depression, and post-traumatic stress. In terms of depression, keep an eye out for the following: feeling down, low motivation, tearfulness, sad, irritable, guilty, fatigue, tiredness, lack of energy and disturbed sleep, withdrawing socially, changes in appetite and weight, difficulty concentrating and making decisions, having a kind of glass half empty outlook on life, and a loss of interest in previously enjoyed activities. Similarly, for anxiety problems, keep an eye out for the following: feeling nervous, tense, wound up, fearful, scared, panicky, agitated or irritable, excessive worrying and fear about things, avoiding things, including activities that were previously enjoyed, restlessness, churning or butterflies in the stomach kind of sensation, difficulty concentrating, disturbed sleep, and panic attacks. In terms of post-traumatic stress, try to look out for the following signs: episodes of reliving the experience. This might include having flashbacks, hallucinations, or nightmares about the traumatic event. Some people might experience emotional overwhelm when thinking or talking about the event, in addition to or instead of nightmares, flashbacks, and hallucinations. Finding that you're avoiding things that remind you of the experience. This might include people, places, things, or memories that remind you of the traumatic event. Excessive arousal, and what we mean by this is increased alertness. People in this state often report persistent anger, fits of rage, irritability, or hatred. They also report difficulty relaxing, sleeping, or concentrating. Some people also report a persistent feeling of nothingness. Some people find that they're feeling little emotion at all, and they feel quite disconnected with people, activities, and other things that matter to them. This might include a sense of "this didn't really happen to me," like it was all just a bad dream. So, as I've said earlier, it can be normal to experience symptoms like this after a cardiac event, and most of the time it's something that passes with time as you recover. So, given that things like anxiety, depression and post-traumatic stress are things that can negatively impact a physical recovery if they persist, at what point should you seek help with managing your mood? I tend to advise the following: seek help if you are feeling down or anxious or experiencing post-traumatic stress for 6 weeks or more. Seek help if things seem to be getting worse or they don't seem to be getting any better over that time period. And most importantly, seek help if you feel that your mood is negatively impacting on your life and your recovery. If you do think that you might need to seek help, you can contact the cardiac rehab team to talk about this. Alternatively, you can discuss your mood with your GP, who should also be able to provide assistance. There are, of course, times when you need to seek help immediately for your mood. This is important if you're experiencing either of the following: if you experience thoughts of wanting to be dead or of harming yourself in some way, your first point of contact at that point should be your GP. If you're experiencing an active and immediate urge to end your life, or to harm yourself, you need to speak to your GP as a matter of urgency, or alternatively attend your local accident and emergency department at the hospital to ensure that you get the urgent assistance that you need. On a more positive note though, you'll be pleased to hear that there are things that we can do to keep ourselves emotionally well. These are things that were identified in a government-funded research study called the Foresight Project about how to achieve the best possible mental development and mental well-being for everybody in the UK in the future. So this isn't just guidance for people who are struggling, though we know that these things will help them too. It's for everybody to keep themselves emotionally well. There were 5 areas they identified as important for emotional well-being. The first was to connect. Connect with the people around you, family, friends, colleagues and neighbours at home, work, school or in your local community. Think of these relationships as the cornerstones of your life and spend some time developing them. Building these connections will support and enrich you every day. Given measures such as shielding and social distancing, it's more important than ever for us to connect, even if this means finding new ways of connecting without having face-to-face contact with others. The next area they identified was to be active. Now, this doesn't have to mean undertaking a structured exercise program, though it's fine if you want to do this. The most important thing is to find a way of moving your body in a way that you enjoy, that suits your level of mobility and fitness and feels comfortable. Whether that's going for a walk, doing your cardiac rehab exercises, cycling, playing a game with your grandchildren, gardening or dancing. We know that there is something about exercise and moving our body that makes our mood feel good. The next area was to stop and take notice. Be observant. Look for something beautiful or remark on something unusual. Savour the moment, whether you're on a bus or in a taxi, eating lunch or talking to friends. Be aware of the world around you and what you're feeling. Reflecting on your experiences will help you appreciate what matters to you. Another area they identified was to keep learning. Our brains like to be stimulated and they love trying new things. Whether this is to rediscover an old hobby, signing up for a course, setting yourself a challenge or taking on a new responsibility, a sense of purpose and achievement really boosts our mood. Learning a new recipe, trying something new or getting better at something you already enjoy is a really good way to have fun and boost your confidence. Finally, they identified that giving was an important factor in keeping ourselves well. As humans, we thrive on doing things for others. Making the effort to do something nice for a friend or a stranger, thank someone, smile, volunteer your time or do something for your community makes us feel good. It also helps us feel connected, which we know is important. Just giving your time or assistance to others is often more than enough to reap the emotional benefits. So, this brings us to the end of our talk on emotional well-being and your heart. I hope that you found the information useful for your recovery, that you have an idea of what to expect, what to look out for, and when to seek help. I've listed some resources here that you might be interested in accessing. The British Heart Foundation have some information on the emotional impact of heart problems that you might find useful. Mind have some really helpful information on mental health generally. The Samaritans are excellent if you just need to speak to somebody about how you're feeling and perhaps get things off your chest a bit. Finally, the Call Helpline are a great support for emotional well-being and advice on mental health. Finally, I know that many people are struggling with worry about COVID-19, both in terms of their health, but also in terms of the impact of safety measures upon their emotional well-being. We have a self-help guide to help our cardiac rehab patients with this, and if you'd like a copy, please do contact us and we can get one sent out to you. So I'd just like to say thank you for taking the time to listen to this presentation, and thank you for taking the time to think about your emotional recovery from your cardiac event. If you need to contact me, you can get me by calling the Swansea Bay Cardiac Rehabilitation team. It's been an absolute pleasure to talk to you today. So now it's goodbye from me, and I'd like to wish you all the best for your recovery. Best wishes to you all, and bye-bye.